out of the woods. We are still seeing significant numbers of cases reported. We are still seeing outbreaks among vulnerable populations. We are still seeing significant deaths in Mississippi. Less than a month ago, there were a couple of days where we reported close to 100 deaths in a given day. And so we still have a long way to go in this pandemic to really reduce the numbers. Now, we've had a couple of efforts to try to reduce transmission in the state. First and foremost has been non-pharmaceutical interventions. Those are the things that we've been preaching now for months. Wear a mask, socially distance, make sure that you're avoiding large gatherings, make sure that we're protecting especially those family members that we have that are among the vulnerable population. We know that younger folks who become infected may have less of an impact with severity of illness. Certainly we see less hospitalizations, less deaths among younger individuals. But we do know that individuals between the ages of 20 to 49 can be one of the primary transmitters to the most vulnerable people in our population, especially family members. And when an individual 65 and older or an individual with chronic underlying health problems becomes infected, it can be devastating. It can lead to hospitalizations. It can lead to deaths. And when we look at where our deaths are occurring, they are largely in our 65 and older population. So we still have work to do. And even though we are now for the last month and a half been working towards vaccination, and we'll talk about that a little bit, certainly it's imperative that we all still maintain those non-pharmaceutical measures that we've been talking about now for months. Continue to wear your mask, even if you've been vaccinated. Continue to socially distance. Don't get together for Super Bowl parties this weekend with folks outside of your normal family group, because we know if that occurs, transmission is going to occur. We've seen some leveling off, and we've seen some progress in the last couple of weeks in the occurrence of deaths and the occurrence of cases, but we are still very high in the state and still have quite a bit of work to do. Now, and I'm going to turn it over to Mr. Craig in just a moment, but I did want to let y'all know that obviously we have started vaccination efforts in Mississippi. Currently, the eligibility for vaccination in the state are individuals who are healthcare personnel. That's any and all healthcare personnel. That includes emergency management services as well. People who are residents of long-term care facilities, individuals who are 16 to 64 years of age with certain underlying medical conditions, things like obesity, individuals who are smokers, individuals who are diabetic or have chronic heart disease. All of the folks fall into those categories being eligible for a vaccination. And then our most vulnerable population, folks 65 and older. We have managed to vaccinate somewhere in the range of about 150,000 folks who are 65 and older in the state. And that's great. But when you look at the total population that falls into the eligibility criteria in Mississippi, it's somewhere between the range of 1.2 to 1.4 million individuals in the state. So we have a long way to go. Currently, just to kind of give you an idea of where we are with our vaccination so far, and remember this is currently a 2-dose series, we have vaccinated about 250,000 people in Mississippi with a first dose. We have vaccinated almost 50,000 people in Mississippi with a second dose, so they've completed the series. So far in Mississippi, we've administered 305,000 vaccines, but there are some equity problems. We have found that whites make up about 69 to 70% of the individuals vaccinated, whereas African Americans make up about 17 to 18% of the individuals who've received vaccination so far. So we still have a lot of work to do. One last thing that I'm going to talk about before I turn it over to Mr. Craig is how we get vaccinations every week. And certainly the supply, the demand far exceeds the supply that we get currently. And remember that I said about 1.4 million people are eligible for a vaccine in the state. Right now, about for first doses, and that's an important dose because that can give you up to 85% protection. Right now, we get somewhere in the range of 37 to 45,000 first doses a week. And you know that Mr. Craig has been really working on those drive-through clinics, and a good portion of our vaccine goes to make sure that we maintain supply in those drive-through clinics. Those have been a great success, which leaves us a little bit of vaccine to spread around to our other providers. But as you can see, there's constraints on the vaccine supply and the demands for vaccine. We wish that we could open it up to anybody and everybody, but right now we are still need to work through some of the priority groups, especially those folks over the age of 65, make sure that we have good penetration in them. So I'm gonna stop talking now and turn it over to Jim to give him opportunity to talk about what we've been doing with the drive-through clinics and how those are working in y'all's communities.
Yeah, thank you, Dr. Byers, and thank all of you for being part of this conversation today. We are operating the state drive-through locations throughout the state. In fact, I'll share a little map right quick just so you can see where some of those are. Are you able to see that, Dr. Byers? Okay. So as you can notice, in each of the old public health districts, also the MEMA regions, the same regions that are used by the Highway Patrol, we've allocated 2 locations in each of the counties or in each of the regions, with 3 in the metro area, in the Jackson metro area, both in Hinds, Rankin, and Madison counties. Each of these sites operate to vaccinate approximately 1,000 people a day. We have 17 teams and 19 sites. So we're not at every site every day, but we do move around the state trying to make sure that we're providing 30,000 of those 37 to 45,000 doses per week through the high throughput vaccination locations. I put Madison in yellow. It has been operating at the Madison County Health Department. As our numbers have increased with second doses, we will be moving that location. Starting next Monday, that location will move from the Madison County Health Department to the Canton High School. So we'll be providing notification to individuals who had appointments for Madison County Health Department that their appointments will now be moved to the Canton High School. It's a much larger location for us, and we'll be able to ensure that the lines move efficiently through that process. So just so you understand a little bit of the process for the state drive-through locations, individuals go on to a website. It's covidvaccine.umc.edu. It's a partnership website that we have with our friends at the University of Mississippi Medical Center, where individuals can make appointments. Now, as Dr. Byers said, there are a lot more Mississippians eligible to receive vaccine than what we currently have in vaccine supply. In fact, 1.4 million people are currently eligible approximately. And when you look at the amount of vaccine coming in, there will be continued wait times before vaccination opportunities are available to everyone in the current eligibility area. But reservations can be made on that particular website for an appointment, and then individuals show up on the site for our appointment. We only have by appointment at our state drive-through sites. They're not drive up or without appointment. You must have an appointment to be serviced on the site. In fact, if you come and you don't have an appointment, we ask you to or give you the information to make an appointment, whether that's through the website, or for those that may have some challenges with using the website or computers, they can call into the hotline, and the hotline is more than happy to try to help. Understand that hotline sees the exact same appointments that individuals see online. So if there is not an appointment available online, there's also not an appointment available at the hotline. Once they arrive at the site, they will be greeted by a team between the health department and the Mississippi National Guard. They've been excellent partners in assisting us with this mission. They receive a packet of information about vaccination and making sure that they're prepared for vaccination. And then they move to a nurse or a pharmacist who will provide them some counseling to, again, ascertain that they're ready for vaccination. And they move to the shot tent where they will receive the vaccine, a vaccination card, and a sticker, tell them that they've been vaccinated. And then they move to a 15-minute lot. Because this is a new vaccine, it's recommended that individuals remain in the lot for 15 minutes so that we can observe and make sure that there are no reactions. We've had very, very few reactions in our drive-through locations, but we are making sure that we have individuals and EMS individuals at the site just in the event that there is some type of reaction that needs to be dealt with. Our system standard time right now from saying hi to us at the greeting location, waiting the 15 minutes and then departing the site is between 25 and 35 minutes. So that's the average range for service. So really the throughput, it seems to work very, very well. We've gotten some great comments back from individuals and Mississippians that have gone to the sites and had pleasant experiences, and we're glad to hear that. So I'll stop sharing for a minute.
Mr. Craig? Okay, you got out of the map. I had some folks saying, can we get out of the map? Yep. Go ahead. Did you have some more comments, sir?
I did, just a few more.
Okay.
We've also been contacted by a lot of counties who are interested in having their own drive-through locations as a means to provide vaccination in their area. So we've developed a checklist. That checklist has been sent out to those that have expressed an interest in doing county drive-through locations. Once they go through the checklist and make sure that they have some medical staffing available and the other volunteers that are necessary to run a drive-through operation, then we have a Zoom call, much like this, with those officials that are interested in doing it, just to make sure that we have all the planning in place, and then talk about some of the things that the state can provide. And what the state can provide in these county locations is access to our scheduling system, which makes it a little bit easier for individuals to be able to schedule, as well as the documentation that has to occur on the back end of the process, which is a data entry piece into the Mississippi Immunization Exchange, can occur automatically if they're using that scheduling system. We also talk about the types of supplies that might be available along with the vaccine. When we ship vaccine to a location, that there are some supplies that are available to administer the vaccine, and some of the things that are necessary to really run the operation. We always recommend that they stop by and look at one of our state drive-through locations to see how we operate and see if there are things that they could bring to their county. So working to develop more and more sites, we have about 7 sites right now that are 7 counties that are interested in developing county level drive-through sites, and we'll continue to work with them to help develop those out. But drive-through vaccination is just one way to bring vaccination to your county. A lot of healthcare providers, whether it be hospitals, federally qualified health centers, or other clinics, are also receiving vaccine through our partnership program. And so it's a matter of how do you want to bring vaccine into your county. We have the state sites that anyone in the state of Mississippi can access, but there are other opportunities that are being developed throughout the state of Mississippi with the various partners. And that's all I have for now.
So Jim, and excuse me if I didn't hear this, can you talk about, because I have gotten this question a lot from members of this audience, how you choose, how the Mississippi State Department of Health chooses where its sites go? There's several considerations. Can you talk about that a little bit?
For the state sites, I take.
Yes, I am talking about the state sites.
Yeah, so obviously the regional representation, looking at where the transportation routes were. So if you look at like Panola and DeSoto County, trying to stay close to Interstate 55 to make it easy for people to gain access to the sites. And then in areas where we didn't have interstates or major or highways really close, looking at those larger population areas within these public health districts. The other thing that, just to let you know, this is an evolving process. So you may recall that we've been doing testing for COVID throughout the state of Mississippi at our county health departments. And we had some drive-through tents to help support that in a number of the locations. So as it started, we tried to transition to just use those county health department locations. But as more vaccine became available, it was very clear that we needed to develop high throughput locations. So these high throughput locations were really created based on where we could have enough team involvement in an area that was easily accessible and that was geographically represented through these regions.
Thank you, Jim. I'm going to go to some of the comments from Melinda. I have heard great things about how smooth the process was through these various sites. Thank you, Melinda. We hear that a lot and we appreciate the good comments. It's a challenging task for sure. From Board of Supervisors, how long, and I'll throw this to you, Paul, how long do the vaccines last after both shots?
Oh, isn't that a great question? Currently unknown, but we anticipate that it gives immunity for several months, if not longer. New vaccine, it's only really been out for a short time. And so determining how long the immunity lasts is going to be something that we're going to learn more about as we move through this process. But right now, we anticipate that it's going to be several months protection.
Thank you, Paul. Jim, is there a plan, and I want to talk about this a little bit, is there a plan to control non-Mississippi residents from jumping ahead of Mississippi residents? That is a great question, and I have worked with a lot of reporters in Louisiana and Tennessee to ensure they understand that you either have to live in Mississippi or work in Mississippi. Why don't you take it from there, Jim?
No, I think you're exactly right, Liz. You know, what we've been telling people from the beginning is if you live in Mississippi, or if you're working at one of our hospitals or other locations here in Mississippi where you're around Mississippians quite often, we want you vaccinated. And so we encourage anyone who works or lives in Mississippi to get an appointment and get a vaccine here.
And if I could add too, we've given in Mississippi more than 300,000 doses in the state. And so far we have a little bit over 5,000 individuals who've been identified as having an address outside of Mississippi. And many of those are individuals who work in Mississippi as either healthcare workers or in other areas within the state. And so we want to make sure that that we protect individuals who are working in Mississippi as well. And I saw a question pop up about residency is not a question on the scheduler. No, it's not, but address is. And we ask for an address in Mississippi or your address of workplace.
So Dr. Byers, thank you. And I want to say, I think there's been some confusion, not an effort to undermine the process, because we had a reporter in Louisiana writing a story about all these people who came here and they got their vaccine before they could in Louisiana. And the reporter wrote a follow-up story today correcting it. So we'll continue to get that accurate information out and hope that everybody is honor bound as we go through this process. The next question is, the site says, it's Bernetta Ann, the site says no first dose appointments are available at this time. When will it be available again, Jim?
So there's a couple of things that are probably interesting to note here. One is that every day we have a number of no-show appointments, people who had an appointment and for one reason or another either found a vaccine appointment that was sooner or just canceled their appointment for the day. And what we do with those no-show appointments is we roll them forward to the very next opportunity at that location. So shots today that are no-show, on Monday, those appointments are moved. So those appointments come open between about 5 and 6 every evening. They're very few because our no-show rates range between 4 and 6%. But those are appointments that are out there. Beyond that, once a week, as we get our allocation in from the federal government and we get the allocation to drive through, On Tuesday mornings, usually around 7 o'clock, we start providing those appointments out for the next period. So those are really the best times to look for appointments. It's not to say that there aren't appointment opportunities during the day, because as people cancel, appointments may come available. But usually short after 7 o'clock on Tuesday, once the appointments for the week are gone, that's the bulk of the appointments that are gone for the whole week.
Thank you, Jim. Paul, did you have anything to add?
No, just guys, they fill up quick. There's a high demand, and we want that in Mississippi. And we're glad that we've got folks who really want to get vaccinated, and we want to get that out to them as quickly as possible.
Yeah, and it's important to know we get, our distribution based on population, and that's the same throughout the country. And so we're not the only state in the nation that is going through this. All the states are going through this, but we're glad to see so many people want to get the vaccine. Okay, this is from Hunter. Pontotoc County would like to be added to the list of interested counties to eventually open a drive-through location if that is possible. How does Itawamba County get that checklist?
So I saw that question. So I just put in the chat my email address, jim.craig@msdh.ms.gov. You'll send it to us. Ashley and I work that particular mailbox to try to get those checklists out just as quickly as we receive requests.
And so, Jim, a follow-up from Annette. Who do we contact to inquire about our county being a site for vaccine? Can you give your email address again, please?
It's in the chat box, but it's jim.craig@msdh.ms.gov.
Okay, and we took care of Tunica. Rule has a question, and I'm going to throw this to you, Dr. Byers. Our jailers have a serious need to get the vaccine, but we have been unable to get them. Now, we have been working with the private prisons and the jails, and I think the federal program has a program as well. Is that not right, Dr. Byers?
Yeah, so there's a lot of correctional facilities within the state, and many of them are county jails. Many of them are Department of Corrections facilities. In some cases, they may be private prison ventures. In some cases, they are federal prisons, and certainly we've been working with the larger ones to try to work through some vaccination efforts. But jailers and those individuals who work in county jails, if they meet those eligibility criteria currently, are eligible to receive a vaccine at one of our drive-through sites or at a private provider locally who may be providing the vaccine. So, I would encourage any of the county jail staff who have one of those underlying chronic medical problems or who meet those age criteria to certainly get vaccinated. One of the things that we will be working on as more vaccine becomes available, and right now that's one of the biggest limiting factors, is working on how to achieve vaccine penetration into the county jail system for both those jailers who meet the criteria, but also for especially the long-term detainees that you have that meet those eligibility criteria. So stay tuned, that's going to come soon. But in the meantime, I would encourage anybody who works at any facility who meets those criteria to sign up and get vaccinated.
Okay, this is a comment from Melinda, and either one of you can, I'm not sure. When you register through the website, it does ask your county where you reside. Jim, you're shaking your head. You want to comment on that?
Yeah, that's correct. I mean, and the only counties that you can choose are ones here in the state of Mississippi. So again, we're looking for Mississippians that live here, as well as those that come and work here every day.
And we have from EMA, we had 8 states come through our site. The site ran great, and we are glad to hear that. Jim?
Yeah, so that LC, I believe, is our friends at Lawrence County. Lawrence County is one of the county drive-through sites that is up and operational. They've been working. This was their first week They probably have some great stories to share about the folks that come through. But maybe a good point to reach out to Tony Norwood. He's the emergency manager there, and Philip Langston, who's the hospital administrator there in Lincoln County or in Lawrence County. For the most part, you know, they're operating that site, and they're making it work every day for people coming into and through that location. But I think they'll all also attest it's a lot of work. So again, a drive-through site is but one way to make sure a vaccine is available in your county, but it is an important way, especially in Lawrence County.
Thank you, Jim. And then, of course, let's see. We have from the Board of Supervisors, and Dr. Byers, you'll take this. What brand of vaccination is best, and can residents choose?
So the way that we have the vaccine now, the two primary vaccines that we have are Pfizer and Moderna, and they are currently equivalent in how well they protect against infection. So we don't recommend one over the other at this point. We do at our drive-through sites have clinics that are primarily one vaccine over the other. And it's important to understand that if you get vaccinated the first dose with Moderna or the first dose with Pfizer, that you need to get vaccinated with the same brand of vaccine that you got with the first dose. And so, you know, when you go on our website and when you choose a location, it's not based on brand of vaccine for your first dose. We are working to make sure that an individual who got a Pfizer vaccine is able to get that second dose Pfizer at a drive-through, and the same with Moderna. But there's not one that's recommended over the other one at this point.
Thank you, Dr. Byers. And there's Jim's email again. James Fisher is asking, is there any information to indicate that the weekly allocation for the state will increase, or will we stay at 30 to 40 weekly for the foreseeable future? Paul, would you like to start that one?
I would love to say that's going to increase, and I think eventually it will. I think right now we're probably going to be looking around the low to mid 40,000s on a weekly basis, which is actually an improvement. That's a little bit of a percentage improvement. And I think, you know, we're starting to really get into a rhythm now with the vaccine distribution. We would love to have more, and we could always use more, and we can get it out. And I think one of the things that we're demonstrating in Mississippi is as soon as that vaccine hits our allocation for the state, we are ordering it and getting it distributed, either to drive-through sites or to our private external partners for them to administer through their clinics and through their hospital settings. And so, you know, one of the things we're committed to is to get that out as quickly as we can. I think in down the road, we probably will see some increased vaccine. Keep in mind that eventually we're going to have a third and maybe a fourth type of vaccine that will be available. I think that'll probably be sometime in March, but that will add to the total vaccine available to distribute and administer as well for Mississippians. So hang tight. Tell you what, I wish we could get a couple million today, and if we could do that, I feel sure that Jim would have all those doses administered by this weekend.
Yes, he would. Okay, let's see. This is from the Oxford EMA. The Oxford side is running great. Both Department of Health and the Guard personnel have been outstanding and are going above and beyond what anyone could ask for. Nothing but positive comments from the public. Good job. Jim, you want to say anything?
Yeah, thank you, Jimmy. And you know, it's been a great partnership with the community there as well. You know, we have law enforcement folks and others that have played a real important role in that site as well. So thanks to everybody that's making that a successful site for us.
And we go to Tunica EMA. Is there any timeline for when the additional drive-throughs, I think, will be added to counties?
Again, there's a number of them in progress now. I'll share with you that up in Bolivar County. Delta State is in some final planning right now to have, Bolivar County chose the football stadium parking lot at Delta State to be a location. So we're working with them to help do some final work on that one. I think Coahoma County is right around the corner to have a site ready. We've also been in planning with Claiborne County, and they're pretty close to being ready, as well as Sharkey-Essequina has also reached out to us, and they are pretty close to ready. Others have asked for a checklist, and we're planning with a number of counties around the state of Mississippi, both in drive-through and then in some locations, like in Scott County, the hospital has really stepped up in a big way, and they're doing a drive-through model themselves without any state assistance. They have their own appointment system that's working for them in Scott County. So there's a lot of different ways to make it happen. And a county drive-through and a state drive-through is just a couple of them.
Great, thank you, Jim. From Annette, I had my vaccine this morning in Lafayette. Great experience from start to finish. Thank you. And I hope I said that right. I've been here a long, long time, but I think I said it right. Okay. Lawrence County, thank you, Jim. And yes, it's very hard work, but well worth it. We did 300 a day here in Lawrence County. That's a good number.
It is. It's great. I mean, it's fantastic, and you just have to see that teamwork. I was able to be with them on their first day, the first morning, to just be there in case something else they needed my help or anything, and they did. They had it, and they did a great job. They got a really great team over there in Lawrence County.
And I think we may have skipped a question.
Okay, let's see. Oh, yes, I see it. Okay, thank you, Paul. Do the folks that have got the virus and recovered still need to get the vaccine, Dr. Byers?
Yes, currently that's the recommendation, and we don't really have a good understanding of how long the immunity from natural infection will last. It is recommended that whether you've been previously infected or not, that you do get vaccinated. There is one caveat. If you have recently been infected, we would like for you to be over your isolation or infectious period before you go to get vaccinated, to make sure that we limit potential exposures and transmission. So if you've had a positive test, make sure that you're more than 10 days from the onset of your illness, or more than 10 days from the date of your positive test if you were having no symptoms, and make sure that you're fever-free for at least 24 hours with some improvement of your symptoms if you had them before you get vaccinated. There's another recommendation that, because we know that someone who's been previously infected may have some immunity for up to 90 days, that you can defer that vaccination after infection for at least 90 days before you have to get vaccinated, because there will be some protection, but that's not a requirement. And I recommend that if somebody is in those eligibility criteria now and they have an opportunity to get vaccinated, that they do so.
Thank you, Dr. Byers. Lee Moore, Dr. Byers is asking, did I hear correctly that currently the vaccine only protects for several months? Do we anticipate a vaccine with more longevity in the future?
I feel like the longevity of the vaccine protection is at a minimum several months. It certainly may be longer. And, we're going to have to follow that through to see how long the immunity lasts from vaccination, and ultimately how long and how strong the immunity is from infection. So I think we still have a long way to go. I don't think that we need to start trying to figure out a vaccine that has longer immunity until we know for sure how long this immunity is. My suspicion is, and all indications is that this immunity that we get from the current vaccine is going to be strong enough and long enough to protect for months, if not longer.
Thank you, Paul. Thank you. Bernetta Ann, excuse me, there has been mention of a one-shot vaccine. That is true. What is the status? Do you know when it will be available and when Mississippi might have it to offer? Paul?
There is a one-shot vaccine that may get emergency use authorization by the FDA coming up pretty quickly. So it's a one-dose vaccine, and after it gets that EUA approval, more than likely the federal government will make that allocation available to Mississippi. We anticipate that it'll probably be sometime in March before we have any of that vaccine roll into Mississippi. So far, it looks like the protection against prevention of infection is probably somewhere in the 60 to 70% range. But where this vaccine is really helpful and really beneficial is that it's about 85% effective in preventing severe infection, preventing hospitalizations. And so I think, we still have some work to do in looking at the data on this vaccine and see exactly how it's going to be rolled out and what guidelines CDC has for who this vaccine needs to be targeted to. But hopefully sometime in March, we will have additional information.
Thank you, Dr. Byers. Jeffrey Holland, thanks for all the great help we have gotten here in Vicksburg and Warren County. We gave 380 shots Monday, 390 on Wednesday, and are shooting for 430 today. That's like well over our expectations, isn't it, Jim?
It is, and another great county site, the site that we have that operates in Vicksburg. It's at the old Pemberton Mall. I think they call it the Vicksburg Mall now. In the parking lot of that mall, and John Elfer, the emergency manager in that community, has gotten again a great team together to be able to do some vaccination work in that community as well, and it's strong work, very strong work.
Jim, from the Board of Supervisors, what will be a backup plan for elderly who do not have any internet services in rural communities? I'll start with you, Jim, and then Paul, if you want to add any comments, feel free.
Yeah, we recognize that not everyone's going to be able to come to the internet to make their appointment, whether it's elderly or just they don't have access to the internet for one reason or another. We've seen a lot of family members that have assisted the elderly. We think that's great. We've seen churches that have really organized around this issue to try to help their elderly members be able to make appointments. They've even helped them with some of the transportation pieces if necessary. So we also have our hotline that if an individual is not able to make their appointment through the internet, that they can call the hotline. Again, it's the same appointments that you can see online, but at least it allows that that interaction to be done with a person on a phone instead of trying to navigate the internet. So we encourage those, especially those over the age of 75, to contact the hotline if they're having difficulty in